Hello. Hello, today I speak in English just because I have some student from Telegram. They want to learn from my side, so I will prepare. I try to prepare the class in English. So this is a liver. If you do the CT scan, you have to know the exact artery or vein, whatever the located. So you have to learn that basic thing. I have just basic idea provide with you, just because I have to explain the thing in CT liver triphasic imaging. So it's important. There is a inferior vena cava in the side of the liver. So in this point there is a hepatic vein. There is a two hepatic vein opening for both sides. This is the right hepatic vein, or this is the left hepatic vein. And if you do the scan, there was a tumor in area of left or right hepatic vein, it's more important to show that thing, the hepatic vein is coming from which area and where the tumor is. So it's important. Or next thing is this: there is a portal vein from the lower portion of liver. It's going to right side, that is called right portal vein, or another going to left side, it's called left portal vein. So it's the brief thing. Also you have to learn about the hepatic duct. Basically there was a two duct. One is coming from main two hepatic duct. One is coming from the right, one is coming from the left. It's called right hepatic duct or left hepatic duct. After that it's common and connected to CBD. So after that, in between there is a in between the gallbladder will connect to the hepatic duct. So in between, this person is called CBD, common bile duct, or this person is called, I changed the color. From the right or left hepatic duct, both connected. After that, the gallbladder was connected in that person. So this person is called common hepatic duct, CHD. Oh, sorry, what happened? From right left hepatic duct to GB neck, it's called common hepatic duct, CHD. But it's called common bile duct. After that, this person is called common bile duct, CHD. Or in between the gallbladder neck to the hepatic duct, it's called cystic duct. I changed the color for better understanding. There is in this person it's called cystic duct, just because the stone in hepatic duct multiple areas, so you have to know the exact location where is the stone is, or where is the problem is. From end of the CBD, the pancreatic duct which connected that person, it's called ampulla. So it's the brief thing, and I go to the scan. There is a triphasic abdomen scan. image from a patient. So if you look the plain scan, you will see a hypodense area in between the liver. You will see the hypodense area in the liver. So you will scroll down, you will see just hypodense area. This is it. When we put the contrast, if you see that type of thing in liver, you have to do the triphasic scan, arterial, portal and venous, just because in liver hepatic tumor there is the lots of tumor in variety. So if you see the exact diagnosis, so you need to do the scan in triphase. Today it's my first class, so my English is not good. I just try to improve myself. So if you have any question, just comment down below. This is the arterial scan. You have see the abdominal artery here, and after that you go to the, this is the artery, hepatic artery, blood supply to liver, and after that you will see the hepatic lesion in that area. It's not that much enhanced or in arterial phase. You will clearly see that area there is nothing, just artery was visible in this area. So if I go to the portal vein scan, portal phase, you will see the exact tumor area, just because lots of tumor showing reacting in portal phase. So it will be easy to identify the tumor. I will describe that thing. You will see that there is the tumor. It's totally visible in it's totally visible in portal phase. The outline will be sharp in this phase, so that the wherever the liver tumor you have suspected, you have to do the triphasic scan. In this scan, the tumor area will properly showing, enhancing the outline of the tumor. After that we take the venous scan, but if you look closely in venous phase, there is not that much enhancement, or there is not showing any outline of the tumor. If you look closely, there is nothing, just we see. I will show that thing. Oh, this is venous phase or this is plain phase? We see that the hypodense area was seen in the plain scan. It's more sharply visible in the venous phase. Other than that, there is no any significant information about the tumor. So in this case, you have to compare with the portal phase. You will see the difference. The portal phase was showing the exact tumor area. I will show the area. The image is like 1 mm, so it's not that much good. to show. If you see the area is around this, it's a hepatic tumor, you will see the area properly in portal phase. So it's more important to do the triphase if there was any tumor in liver. If you have suspected any type of tumor in liver, you must do the triphasic scan. Now I briefly show you how to do the scan. Before the scan, you have to see the patient creatinine report, just because in liver study we give the contrast to the patient, so the creatinine level is normal, have to normal. So first of all, we need to know the creatinine level is normal. After that, the patient have any allergy of medication, like some patient have allergy with some type of medication. If patient have that type of history, you have to prepare with the medication. If there is a allergic history, you have to ask to radiologist. We in India we gives medicine previously, so that the allergic reaction is not prevent after the scan. So you have to ask to that, and also describe that thing. The patient is not panic during the scan, just because it's feel like little warming and your mouth feel like warming thing happening in your body. So it's nothing, just normal for a few seconds when the contrast is injected. After that, you have to, in liver scan, you have to breathe whole during scan, so that the tumor or wherever is the problem, it's showing properly. After that, you will prepare for the contrast study. If you have injector, it's good, but if you push the contrast manually, it's not that much good result, just because it takes time to outside from the CT room, the technician who is injected the contrast. So you have to little bit of tricks about safety. You have to plan the patient weight into 1.2 ml. If the patient weight is 50, you will put the 0.2 into 50, 60 ml maybe. I don't know, I have to calculate. Patient weight into 1.2 ml, it's the universal ratio to give the contrast in patient weight according to the patient weight. So after that, you have to prepare a plain scan of whole pelvic area. The plain scan will be done. After that, you have to see that there is anything different in this area. So you have find any type of abnormality, it's good to do the scan. It's provide good information to previous scan. This scan we see the liver, there is a hypodense lesion in this liver, so we prepare for a triphasic scan. If the doctor only scan the normal contrast abdomen scan, we will do that thing to diagnose the problem. We will do the triphasic. Now after the plain scan we prepare for triphasic. There is a artery going to the middle of the abdomen and it's divide the right femoral or left femoral. It's artery called aorta, abdominal aorta. In the arterial phase you have to start from the upper of the liver to the bifurcation. It's called bifurcation, where the abdominal artery divides to right femoral or left femoral artery. It's called bifurcation. So in arterial phase you have to just that much FOV you have to scan. After that you have to plan for the portal phase. Portal phase is mainly see the liver area, so you have to choose the FOV within the liver. And next phase is called venous phase. Venous phase is way down to the whole abdomen. Venous phase is way down to the whole abdomen. Just because there was anything problem in lower abdomen, it's also visible. So it's the planning after the scan is happened. You have to 5 to 7 minutes delayed for the kidney, or there was a like a delayed enhancement if liver tumor have like hemangioma like tumor. The tumor have reacted after several minutes of the injection of the contrast. So we have to look for that, so that you have to do delayed scan if there was that type of tumor you see. So if I have that type of case, I share the class with you. So the timing of the plain scan is done. After that you have to prepare arterial scan, and after that you have to prepare venous scan, and after planning of venous you have to prepare portal scan. You have to prepare venous scan. You have to prepare venous scan. It's called portal, it's called arterial, called venous. So in between there is like arterial scan is 4 seconds from the from the locator receive the high Huntsville unit. So the locator will be detect there is a contrast coming in the artery. After 4 seconds the arterial scan will be done after 4 seconds. After that the next scan in within 14, or there was the normal ratio of this plan default in your system. You have to don't edit. You have not worry with the timing of triphasic abdomen. You just put whatever it's default. If you scan like a whole abdomen plus thorax, in that scan you have to reduce the time difference between portal and venous, just because the machine the scan will be more FOV in that thing, so you have to decrease the portal venous time difference. Other than that, the venous phase is little bit late, so it's like some type of delayed in scan. So you have to mind on this. So today class is and here I will prepare next class. If you understand my English, thank you for being here.